Good morning, everyone. Thank you. My name is Vanessa Gonzalez-Plumhoff, and I am Director of Latino Leadership and Engagement for Planned Parenthood Federation of America, and I will be today's moderator for our town hall roundtable kind of setup. Thank you to everyone for being here. Thank you to the leadership of LULAC as well for hosting this town hall on a very important topic. Today, we're going to be talking about the Affordable Care Act, as well as Latinos living healthy and what that means. A couple of interesting stats, and then we'll introduce our amazing panel. The United States is home to over 50 million people who identify as Latinos. Currently, we spend about $2.6 trillion a year on healthcare costs, and yet we continue to rank 37th in the world for quality of care. Obesity-related ailments account for up to 21% of this price tag, and by the year 2030, nearly half of all Americans will be 30 or more pounds above a healthy weight, qualifying them as obese. Nearly 40% of Hispanic children and adolescents are overweight and obese, compared to less than 30% of white youth. And as the nation's fastest, largest, and most uninsured and underinsured population, Latinos will bear a substantial burden in realizing their right to a healthy life. There are many other statistics and disparities that we could go into, but the important thing is that there is hope. The full implementation of the Patient Protection and Affordable Care Act, which we all know as the ACA, will provide an estimated 9 million Latinos in the U.S. an estimated 9 million Latinos in the U.S. will be eligible for health coverage through state and federal programs. Today, we'll hear from our wonderful panel of experts to discuss the multiple factors impacting Latino disparities, effective advocacy strategies, and the ACA, and of course, available resources for improving health outcomes in our community. So, let's get to our wonderful panelists. First, we have Dr. Nadine Gracia, who is Deputy Assistant Secretary for Minority Health and the Acting Director of Office of Minority Health. We have Teresa Niño, Director of Office of Public Engagement for the Centers for Medicare and Medicaid Services within the U.S. Department of Health and Human Services. Myra Alvarez is the Director of Public Health Policy in the Office of Health Reform at the Department of Health and Human Services. Andres Castillo, Senior Advisor, Education and Outreach for AARP. CJ Bowden, Communications Officer with the Silver State Insurance Exchange. And Nanette Ravignon, did I get that right? Pretty close, I hope. Director of Communications for the Know Your Care Nevada. First up, we're going to have Dr. Gracia to make some comments, and then we'll open it up to our panel discussions.
It is really a pleasure to be here with all of you this morning to talk about such an important issue as Latino health. And as Vanessa indicated, my name is Nadine Gracia, and I'm the Deputy Assistant Secretary for Minority Health at the Department of Health and Human Services. You know, like many of you, I come to this conference certainly with a deeply personal commitment to the issues that are being discussed today, whether it's health equity or access or opportunity, that we understand that these are really critical issues for communities of color. As the daughter of immigrants myself, I've seen firsthand how these issues and these questions matter in our nation that is certainly becoming increasingly diverse. My parents came to the United States. We're going to have to start challenging the group next door and start doing our own cheers. My parents came to the United States from Haiti and had the courage really to leave everything that was familiar to them to start anew and come to the U.S. Because they really believe this country to be a nation of opportunity unlike any other. And I'm sure we share that story in many ways. Many of us can talk about similar histories, and I think that's fundamentally really something that we see in the American story, that many of us come here really with opportunity and the hope for opportunity, and nowhere is that more true than when we talk about our health. One of the most important things that any one of us has, and no matter where we come from, no matter what language we speak, no matter what we look like, that it's really evident that health is critically important. And so that's what makes really, I think, the persistence of health disparities in minority communities so alarming in this country. For too long, we know that people of color are less likely to get the preventive services that they need to stay healthy. That when they do get sick, they are more likely to receive a lower quality of care, and that they face a higher burden of many diseases. We know, for example, that Latinos bear a greater burden of chronic diseases like diabetes and obesity. They're more likely than non-Hispanic whites to face certain types of cancer like cervical cancer. And all too often, Latinos have trouble finding a healthcare provider, or at least a healthcare provider that they can talk to. They struggle to achieve good health because the services that are actually available to them don't adequately address their needs. But we know it's not just the healthcare system as it has existed that really contributes to these disparities. It's also where people live, where they learn, where they work, and where they play, these social determinants of health. And unfortunately, what we see in the Latino community are many Latinos who are often living in communities where they are facing places that have less access to healthy, affordable foods, where they're living in unsafe neighborhoods and don't have the ability to engage in physical activity, be it safely or conveniently, where these social determinants of health really are stacked against them. This is what makes certainly what we do so compelling. But we know, and you've heard some of the data already, how important it is for us as a nation to really take these issues to heart. Because in the words of President Obama, our American family will only be as strong as our growing Latino community. Our mission certainly is to think about this vantage point that we have really a remarkable moment of opportunity to improve the health of our communities that have long faced these greatest challenges. And under the leadership of the President and our Secretary of Health and Human Services, Kathleen Sebelius, we have made eliminating health disparities one of our top priorities. 3 years ago, when the President signed the Affordable Care Act into law, it really marked a major victory for the Latino community, which, as you heard, faces higher uninsured rates than any other racial or ethnic group in the country. And we know that gaps in health coverage, gaps in access to care have long been some of the obstacles that our communities face. And what the healthcare law is doing is really helping to strengthen that. And you're certainly going to hear more about this during the panel today. But one of the key points to remember is that taken as a whole, the Affordable Care Act truly is one of the most powerful pieces of legislation in our nation's history that will help us to reduce health disparities. But we know it's not enough often to just initiate these types of transformations, that too often sweeping change has a way of missing the communities where it's needed most. And so that's why, under the leadership of Secretary Sebelius, our department launched the first ever action plan to reduce racial and ethnic health disparities. What it's doing is ensuring that we are infusing health equity and thinking about health disparities in all of our programs, our policies, and the decisions that we make, whether it's transforming our healthcare system or increasing the diversity and cultural competency of the workforce, or investing in community-based programs that will help us to reduce disparities. But truly, it is holding us accountable for what we must do to really achieve health equity in our nation. Just recently, for example, we released the new standards for culturally and linguistically appropriate services in health and health care, or the CLAS standards. What these standards really provide is a blueprint for organizations to understand how to respect and be responsive to the cultural health beliefs, the preferred languages, the health literacy, and other communications needs that people have at every point of contact. Because we believe that certainly the importance of quality of care should never be lost in translation. And we're working with partners across the country to ensure that no matter what language you speak, you have access to the care and services that you need. But really, this is just the beginning. And you're going to hear more certainly about what we're doing with the Affordable Care Act and within the Disparities Action Plan as we prepare in particular for October with the opening of the new health insurance marketplace. Because we know one of the challenges we face is the outreach, the education, the awareness, and ensuring that people become enrolled. And that is so important because we know that we can't do this alone. As we really work towards implementing the Affordable Care Act, one of our charges is certainly to press ahead, to keep the momentum going, and to ensure that we make the most of such a remarkable moment of opportunity. And whether we really rise to meet it and seize on this opportunity and can look back years from now to say that we faced such an historic moment of opportunity and change, it depends not just on us here in the federal government in Washington, D.C., but on all of us working together all across the country. You know, civic engagement, the theme of this conference, this LULAC conference, and the theme that your president, Margaret Moran, has emphasized many times before, has never been more important. For this truly is the time to be engaged. And so as community leaders, business leaders, policy experts, advocates and activists of all kinds, you're the ones that we're certainly looking to. You're the ones that we need, the trusted voices in your communities. So for all that our roots may differ, our stories certainly have common threads, and our journeys are really shared. So I hope that we will continue to work together to ensure that all members of our communities have the opportunity to live healthy lives. Thank you.
Another part of the Affordable Care Act is what's going to be coming down the pike in about 4 months, and that's the enrollment for those who are underinsured or uninsured in the United States. That's a large number of the population, about 41 million of individuals in the U.S. don't have insurance. And one of the key parts about this is that not only is it low cost, affordable, but it's also going to be quality health care because the department has made sure to review which are the plans that are going to be participating in this and make sure that they offer the benefits that we see as essential health benefits, and I'll get to those in a minute. But as you know, each state has to implement healthcare reform in some way. Those that choose not to do it, the federal government will go ahead and do that for them. Here in Nevada, we are very fortunate to see that representatives here from Nevada will be talking about that they're already taking the lead in getting some of this done. And we'll look at a chart in a little while about some other states and which states fall into what place. But pretty much the definition is that a state-based marketplace like Nevada is one that is doing it on their own. They're going to go ahead and implement the healthcare reform on their own. They're going to be receiving federal funding to do this, and it's going to be a very clean, coordinated effort. A state partnership marketplace is kind of like a hybrid, or what you could see as state on training wheels. They can't do it all on their own, whether it's because of technicalities, of just not having the resources. For whatever the case may be, we're partnering with those states in order to implement healthcare reform. So there's some things that they'll be doing, there's some things that we'll be doing, but it's going to be a very integrated effort. So states like Illinois are a partnership exchange or marketplace. And then we have the federally facilitated marketplace. We, of course, because in DC everything turns into an acronym, we call those FFM states. And the FFM states are where the federal government is going to be implementing healthcare reform or doing the marketplace. And this includes places such as Texas and also Arizona. There will also be a special emphasis for small businesses because we know that, that there's going to be a lot of individuals interested because either they work for small businesses or own small businesses. And we'll have more information for them as well. Now, and this is the third time I mentioned healthcare.gov, but it's because I really want you to have it embedded in your brain so that, you know, if you have any questions, you could look information up on there. You could sign up for alerts. This way you're notified whenever there are any changes or announcements. And starting in October 1st, people will be able to apply through this website. So this is the website that we're going to be really utilizing.
All right, next up, Myra Alvarez, again, who is the Director of Public Health Policy in the Office of Health Reform at HHS.
Thank you, Vanessa. I'm very happy to be with you all today. I have a very easy task of getting to share our accomplishments thus far with regard to implementation of the Affordable Care Act. And it's a great opportunity to ensure that you're hearing information directly from us about implementation. We know there's a lot of misinformation out there about the Affordable Care Act. So any opportunity we have to talk to folks out in states across the country about what we're doing, we gladly take advantage of it. So I thank you for your time and your willingness to be here early on a Thursday morning. So since LULAC was founded more than 80 years ago, this organization has fought for a simple goal that's at the heart of the American dream, and that's equal opportunity for all people. And I think we can all agree that you can't have opportunity without good health. A child who doesn't have glasses can't pay attention in school and will likely fall behind her peers. Parents who can't get treatment for their chronic disease are going to miss work and potentially be passed over for promotions. Young people who have a stack of unpaid medical bills will have a hard time pursuing their dreams. If we want to give every Latino and every American across this country a chance to reach their full potential, we need to start with improving health. As Dr. Gracia explained, one of the single biggest steps we can take to improve opportunity for Latinos is to reduce health disparities. And that's what we've been doing these last 3 years since the Affordable Care Act was signed into law. Dr. Gracia spoke a bit about why we needed health reform and shared some of the numbers that describe how Latinos are often hit hardest by the lack of insurance. She talked about our action plan and how it's going to help us move forward. Teresa talked about what's right around the corner with the health insurance marketplace. I get to tell you about how these last 3 years' implementation of the healthcare law has aimed to build on what works in our healthcare system and fix what's broken by focusing on 4 key areas. The first is creating new common sense rules of the road for insurance companies, so we know that our insurance will be there when we need it the most. For example, they can no longer deny coverage to children because of a pre-existing condition like asthma or diabetes, illnesses that often hit Latino children hardest. Until that protection is extended to every American, we've made available a pre-existing condition insurance plan in every state across the country, where 100,000 people have been able to access coverage, despite the fact that they have a pre-existing condition. Today, there are 3.1 million young adults who have coverage because they could stay on their parents' plan until the age of 26. Out of those 3 million, close to 1 million are Latino young adults. And 105 million people across the country that have private insurance today no longer have to fear that their benefits will disappear right when they need them the most because of a lifetime cap that their insurance company put on their plan. Those have disappeared. These common sense rules of the road will strengthen insurance for many of us that have it today, but for the many that will have the opportunity to have health insurance in the future as well. Secondly, we've taken additional steps to drive down costs for families and small business owners when it comes to the private insurance market. For example, the new 80-20 rule, which limits how much of a premium insurers can spend on overhead and marketing, and the rate review program have led to billions of dollars in savings for American consumers. For example, just today, just this morning, we announced that in 2012, $3.9 billion was saved for consumers because of these important reforms that we're placing on insurance companies. $3.4 billion was saved up front because we're requiring insurance companies to focus their services on actual healthcare, their dollars on actual healthcare. Before the law, insurance companies spent 60 cents of every premium dollar on healthcare. But that other 40 cents was CEO bonuses or overhead, things that we couldn't explain. This 80-20 requirement really focuses insurance on what it should be paying for. That's your healthcare or improving the quality of your healthcare. And in addition to that, the new rate review provisions have ensured that insurance companies can no longer hike your rate by more than 10% without some sort of public justification, a reason why those insurance premiums are going up so much. And since these reforms took effect, the share of double-digit increases requested by these companies have plummeted. Those double-digit increases, 75% of the increases were double digits in 2010. This year, 14% of the increases are double digits. And while insurance premiums are going up, they're actually going up at a slower rate. So that's an important opportunity for us to, again, have some transparency in the system and be able to control the cost of premiums going up. The law, third, is also strengthening our Medicare program. There are 50 million people that depend on the Medicare program today. And for those of us that don't depend on it today, I'm sure in the future we'd like it to be there and we'd like it to be strengthened for us. What we have opportunity to do through the Affordable Care Act is give seniors access to new benefits like free preventive care, so they don't have to worry about a copay and potentially skip a life-saving screening because they couldn't afford it, but also savings on prescription drugs when they hit the coverage gap, known as the donut hole. As of March of this year, more than 6.3 million people with Medicare saved over $6 billion on their prescription drugs because of the healthcare law. This year, the discounts that we're giving to seniors that hit the donut hole is a 52.5% discount on brand name drugs and a 21% discount on the cost of generic drugs. Last year, on average, the senior that hit that donut hole saved $706. $706 for seniors across this country that often lived on fixed incomes is a lot of money. It's a huge opportunity to ensure that they're not only getting the treatment that they need to stay healthy, the drugs they need to stay healthy, but also to be able to prioritize other things in their daily life, whether it's buying groceries or putting gas in the car or taking care of their grandchildren. $700 is a lot of money. And finally, the law is ensuring we all have greater access to healthcare services in our communities. For those in our communities that have insurance, we've been able to strengthen the ability to access preventive care services. When we talk about the Latino community and the health of the Latino community, we are disproportionately impacted by chronic disease, diabetes, heart disease, certain types of cancer. But the most tragic reality of those chronic diseases is that oftentimes they're preventable, or they can be identified early if we go to the doctor and we get a checkup. Unfortunately, that copay, that $40 or that 20% coinsurance rate, that stands in our way, and that stands in the way of millions of people across this country. What the Affordable Care Act does is do away with that cost-sharing requirement. So there's no copay to worry about. There's no premium or deductible associated with preventive services. Today, 71 million people, including 8.2 million Latinos with private insurance, can access those preventive services for free. Everything from mammograms to blood pressure readings to contraception is free for millions of people across the country. And I think we can all appreciate that in addition to having an insurance card, we also must work to improve the health of our communities and the ability to access care in those communities. So since 2009, both with the Recovery Act and the Affordable Care Act, the administration has nearly tripled the size of the National Health Service Corps. This is a program that I'm sure some of you are familiar with, but for those of you that don't know, this is where the federal government says to medical students or nursing students or doctors and nurses that are in their career, if you practice in an underserved community, the federal government will be able to give you a scholarship or be able to pay your loans back. That's a big deal for people that are graduating from medical school or nursing school with $200,000 in debt or $300,000 in debt. We've been able to make huge investments in this program, and as a result of it, really invest in the diversity of our healthcare workforce. If you look at physicians across the country, Latinos make up 5% of doctors, 5%. If you look at the physicians in the National Health Service Corps, Latinos make up 16% of the physicians. It's clear that an investment in scholarships and loan repayment programs is telling that young Latino medical student or that young college student that's considering enter the medical field but worried about the cost, that they don't have to worry anymore because they have some federal support in the future. And one of the best components of the program is that we're not seeing people hop into underserved areas or rural communities or reservations and then leave. They're staying in those communities and they're contributing to the continuity of care. 80% of the people that are in this program stay in the communities in those underserved areas, and again, are contributing to the overall fabric of the healthcare services in that community. And I think we all appreciate the role of community health centers across the country. Thanks primarily to this law and the Recovery Act, health centers are serving 4 million additional people than they did just a few years ago. And of the over 21 million people treated by health centers, 1 in 3 are Latino. So an investment in community health centers that provide culturally competent and linguistically appropriate care is an investment in the well-being of our Latino community. We've been able to create new health centers across the country, but also add services to health centers that are already doing the right thing. So they can add a dental chair, so we can have somewhere to go for dental care, or they can add a mental health professional because there's support from the federal government to make that happen.
Coming in August, we're very proud of a new online tool, mileydesalud.org. This tool will prompt you to answer 7 very basic questions, and it will give you a personalized report on what the healthcare law means to you and your family, and it will give you local resources. That's coming August 1st. Obviously, it's going to be in Spanish. It's also in English. It's called healthlawanswers.org. And it's also mobile and tablet friendly, which is important for the Hispanic community that over-indexes in mobile devices. I know there's a saying, what happens in Vegas stays in Vegas, but I hope what happens in this session does not stay here. We actually take the information back to our communities because Latinos could certainly benefit from the healthcare law.
Con amor, con orgullo y con gusto, porque sé que sí se puede. Sí se puede, 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 sí se